Welcome to this seminar in the Dean's Speaker Series. For those of you who have not met me, I'm John Samet, the Dean of the Colorado School of Public Health. Just a few housekeeping sort of announcements. We are actually webcasting this via Zoom. For those of you who are in Zoom, your lines are on mute. Too bad. If you have questions, though, when we come to the question and answer period, send them on to Crystal Chaparro, who will relay them on to our speaker, Tom Burke. I'm delighted to introduce Tom, a colleague and friend from our years together at Johns Hopkins. Tom, after his stint at the EPA, returned to Johns Hopkins, where he is the Jacob and Irene B. Fabricant Professor. We can tell you about that. And director of the Risk Sciences and Policy Institute, among other things that he does. Tom came back to Johns Hopkins after 2 years in the EPA as unconfirmed. He can talk to you about that.
Yes.
Head of the Office of Research and Development at EPA and the science advisor to the administrator of EPA. Just a few things about Tom. First, you need to know he's from Jersey.
Hey, that's pretty good. Oh, yeah.
All right. And
what exit? Yeah.
And those of you from Jersey know what that means, apparently.
I'm from Jersey City, which is the new Brooklyn now, and it's not the Jersey City I know. I hear people complain that Denver's changing. You should see Jersey City now.
Okay, enough of that.
Okay.
And Tom is a great storyteller, as you're going to learn. I think importantly, beyond his research, an important part of his practice has been contributing nationally through critical committees on risk at the National Academy of Sciences, Engineering, and Medicine, chairing the committee that produced an important report called Science and Decisions, more recently heading up a group planning a new initiative at the National Academy's Environmental Health Matters, which we all think it does. So we're delighted that Tom came to talk to us. His title portends the importance of what he'll be talking about. So thanks for coming.
Thanks, John. And John, thanks for all that you do and have done for environmental health and public health in general. He's been a great colleague, and you're very fortunate to have him here. So, I worked at EPA. I was the science advisor. You've probably been reading some press stories about EPA, and things are changing. How many of you are actually in the field of environmental health? Okay. I remain optimistic. So hang in there. But I want to reflect a little bit. First of all, tell you just a wild ride I've had. In my mind, I'm just a kid from Jersey City who worked real hard at school and loved science and loved the things I was doing. And I have been incredibly fortunate. I started off working in state government and in the new Department of Environmental Protection in New Jersey. I was asked to become Deputy Commissioner of Health in charge of all occupational environmental health and infectious disease, the state epidemiologist. And then probably no phone call was quite as exciting as when my secretary at Hopkins called and said, it was soon after the re-election of President Barack Obama, and she said, "Tom, it's the White House." And I said, I'll take that call. So there was in the executive office of the president. When I come down, I've been mentioned as would I'd like to join the leadership team with President Obama. I'll come down. I'll have that discussion. But I entered into this world of politics. Now, I had worked for 4 governors in New Jersey, Republican and Democrat. I had always tried to remain, as a scientist, focused on the data, focused on the scientific message, and it had served me well. And so when I went down there and I said, I'm not a member of the Democratic Party, I'm an independent, they said, that will probably serve you well going through the Senate confirmation hearing. So how many of you are doctoral candidates who have to defend your dissertation someday? Okay, it's a stressful day, but it ain't nothing like a couple of Senate hearings. Now, it wasn't quite, and there's been a little bit more drama in recent Senate hearings, but my wife did sit behind me for 2 confirmation hearings, and anyhow, it's been an amazing ride, and you may recognize Senator Inhofe. He was the chair of the committee that I hoped to confirm me. And he once brought a snowball into the Senate chambers to show that there is no global warming, because look, it's cold outside. There's snow in Washington, D.C. And so I got cross-examined by him on my views on the evidence of climate change. And it was a wild and exciting ride. One of my proudest partial accomplishments is being the science advisor during the great work that went into preparing for the Paris Accord. And it was an amazing ride. I got to serve in the administration, to serve as the top scientist for the agency, and work with an incredible member of the cabinet, Gina McCarthy, who's now at Harvard University, but just what a leader that really respected the science. Now, as you might imagine, things are changing dramatically. I don't want to go too political on this in this talk, but well, those of you who want me to, just give an amen. I won't go there. But I did have to leave at noon on January 20th of 2017. So I guess in a way I got fired by that guy. But anyhow, what a contrast, particularly on climate, but so many of the different scientific issues. And shortly after leaving, I had the privilege, really, to co-author with John Samet an article to present the importance of the science to the New England Journal of Medicine. And I just want to quote that a little bit. And this is kind of one of the messages of this talk, but I want to challenge you in this talk to kind of see the real world, see the front lines, and think about science and public health a little differently. So the bottom line in our paper, and we had written a similar paper in a previous administration as well, so this wasn't something that we had never done before. When there's a transition in government, it's very important that we continue to respect the science. So our message was, we believe that evidence-based decision-making on the environment should not be abandoned. Reasoned action and acknowledgement of scientific truth are fundamental to democracy, public health, and economic growth. Scientific evidence does not change when the administration changes. The administration should not abandon the majority and most critical stakeholder, the American people, for a coterie of special interest stakeholders. Well, that was a hopeful message. I remember my goodbye all-hands meeting at EPA. There were lots of scientists who were really concerned about the days ahead, and I said, this country will always need strong science, and I tried to portray this message, and that is still my message, although clearly things changed. And there you see Scott Pruitt. I'm not going to say he was a weirdo, but he did spend $1,500 on tactical pants, which somehow, through all my frontline experience, I never had to purchase tactical big boy pants. It's my last Pruitt joke, because I did go to the front lines, and all throughout my career. I think it's very important for scientists to get out the front doors, to get out there with the folks who are most impacted by our decisions. So whether it was Colorado and dealing with a famous temporarily orange river system, and meeting with the Navajo and the sheriff of Durango, who is the ultimate public health authority in La Plata County, or whether it's the front lines of Flint or the wildfires or the loss of safe drinking water in Toledo, Ohio, or fracking, or even, and this is really cool, so does anybody know what that room is there on the very top? And Wolf Blitzer never gets to sit there. That's the Situation Room. And talk about a cool place. I wanted to take a picture for things like this, like a selfie that I was really in there, but you can never bring your phone or camera in there. That's in the White House, and through briefings on the emergence of Zika and the tough decision-making and the national security threat that Zika may have presented to this country, I actually got to represent the public health point of view at the very highest levels. So just to give you some examples of the kind of things that I worked on, and then I want to, no joke, drill down on fracking a little bit. But from the health impacts of climate change to the Clean Power Plan to the clean air standards, I think one of the great accomplishments of my tenure there and the administration was the lowering of the ozone standard to protect the respiratory health of millions of Americans. Worked on the major study of fracking that I'll talk about, but in Flint and around the nation on drinking water safety. I already mentioned Zika and cancer issues. And then there were those pesky little specific ones that will keep me busy for the rest of my life, like glyphosate and Roundup, chlorpyrifos, the fluorinated compounds that unfortunately we have such widespread exposure, and certainly Colorado is no stranger to. So I don't think people realize just how important EPA Office of Research and Development is. But I would have to say, in terms of, in the past, resources and multidisciplinary capacity, from exposure to public health to toxicology to emerging computational toxicology, it is the strongest laboratory for environmental public health in the world, and it's a resource we have to protect. And there has been an assault on science. Clearly, it's very hard to get any traction on scientific issues on, say, something like climate or pesticide hazards when there's an ignoring of the evidence. But this is not new. So some say, wow, this administration is really horrible, and the current EPA administrator. But I have to tell you, I have been in this game for a long time. And since science has been the basis of regulations, there has always been attacks on whether it was the tobacco industry talking about how 9 out of 10 doctors recommend Chesterfield and see no adverse effects in the respiratory system after studying them for 3 weeks. So science has always been kind of vulnerable to attacks from the regulated community. And what has become an art form now, unfortunately, and certainly when you're sitting in the seat in Washington to see this, if you don't like the rule, if you don't like the cleanup cost, if the profits from your products are threatened, attack the science. It's become a very well-developed and clearly well-funded art form. And frankly, since I've trained literally thousands of scientists over the course of my academic career, and many of whom are in the private sector, many of them in the public sector, academia as well, I know the game pretty well. And we are in a very vulnerable point in particularly environmental health, but in general, all right? Want to repeal rules or avoid future liabilities? Destroy the scientific enterprise. That's what I'm most concerned about now. Whether it's attacks on funding for research on environmental health, or whether it's just the very existence of EPA's Research and Development Office. And you see things now with very powerful senators saying EPA was never meant to be a national research organization. It's a regulatory body. Let's get to the core mission. Let's get regulatory clarity. Let's not be encumbered by scientific evidence. And unfortunately, public health is collateral damage to all this, and it affects the health of millions of people. We have to do better. So one of the things that I was very involved in, and that I'm sure you've seen in the headlights, I felt like I was in the headlines, is glyphosate. Any of you ever use Roundup on your front lawn, back lawn, live near a farm that perhaps sprays it? Well, that's a map of the national use, and really there's a time sequence on the web of this. But glyphosate, Roundup, and its similar compounds with glyphosate as its active ingredient, is the most widely used pesticide, herbicide on the face of the earth. And there's lots of things that have pushed this forward. Primarily, though, the development of genetically modified crops to be used in concert with Roundup. But it's a really good weed killer, too. And there's really tough debates going on now about evidence of the hazards of this. Now, why do I bring up glyphosate? Well, because I was involved, the EPA had to make a determination. The World Health Organization International Agency for Research on Cancer, made a determination that glyphosate is a probable human carcinogen. That's right, John, right? EPA also has, the pesticide program, the responsibility to make a determination. Now, as a science advisor, I had the responsibility of weighing in on the evidence, but there was lots going on about that evidence, particularly by the manufacturer, Monsanto. And Monsanto, turns out, watched not just my office, not just EPA, but certainly IARC and the World Health Organization, and learned, just as I think the tobacco industry has learned long before, using this playbook of creating doubt about science to avoid regulation or to avoid threatening scientific conclusions. And here you see just a press clip. The plan on Monsanto's part was to create enough controversy to discredit IARC's evaluation because they knew that regulators, EPA, would be influenced by that finding, and continued use of the top-selling chemical would be at risk. And so from their emails, you see it is possible that IARC's decision would impact future regulatory decision-making. Well, clearly this debate goes on. I have to say one of the joys of having been a public service a servant at the highest level is there's this thing called litigation holds on all your correspondence, all your emails, all your texts, anything related to things that were involved, and well, glyphosate is one of them. And I really worry with peer review by the Congress right now on so many very important public health issues. And clear, this is Chairman Smith of the House Science Committee. Should be our elected officials who are most supportive of the scientific enterprise in this country. But Chairman Smith really wanted to investigate this IARC program and led the efforts to cut the funding that the U.S. provides for WHO, for this program, because of, as he said, the American people deserve to know the truth about which substances are safe and which ones pose risk. Glyphosate is the most widely used herbicide in the world. Americans and people across the globe rely on these crops for high-quality, affordable food. There are real repercussions to IARC's unsubstantiated claims. Well, welcome to the world of the EPA science advisor, but really welcome to the world of science, whether it be fracking debates here in Colorado or public health debates on the local level. So now I want to use three examples. And the reason I chose these examples, or Colorado is very, very much involved in two of these, but we're all involved in the third one, the Flint issue, and drinking water quality in the U.S. But I'm also presenting these because they just call out for a new way to do public health, which is maybe getting back to basics of understanding the systems of what we do in science and in public health. So when I first got to EPA, Gina McCarthy was an amazing character, and she's from Boston, and you might imagine Burke, McCarthy, two Irish Catholics, a little bit tough. And so for those students here, so I have all these interviews at the White House, all these Secret Service interviews, all these FBI interviews, and they ask you amazing things about, whether you were crazy in high school, believe it or not. And they go back to people you knew from high school and ask, hey, was Tom crazy when he was in high school? And tell us something nobody knows about Tom. And all this the incredible vetting process. So I finally make it. And my last interview was with Gina McCarthy, the administrator of EPA. And we go out to lunch across from EPA headquarters on Pennsylvania Avenue. And we're just eating lunch, having a great time, talking about the Patriots and the Eagles. And then she says, so Tom, that's Boston accent. So Tom, what are you afraid of? So I'm from Jersey City. I'm thinking, this woman is a genius. What a great question. I've never had that question in an interview before. All those interviews at the White House, they never said, what are you afraid of? So I drew on my roots, and I said, nothing. Which was the right answer. I got the job, right? Because you have to be kind of fearless to do science. You have to stick your neck out. You have to have your neck supported by very strong evidence, but it worked out. And when I asked Gina my first day on the job, January 12, 2015, what do you want me to focus on? She said, and Remember that line in The Graduates? I have one word for you, plastics. She said, Tom, one word, fracking. And I'm like, oh, can you give me something a little easier to start with? So where are the wells? Well, we were talking a little bit earlier. Colorado has its share. How many oil wells in Colorado? Anybody want to guess? John says 51. Okay, but what percentage do we really know about? So that was the thing. So you can see where the shale is, and you can see the distribution, and clearly Texas and Oklahoma and Colorado and the Dakotas, and this is a national issue, and we studied data from 275,000 wells. The country has been transformed from an energy perspective by the development of hydraulic fracturing, but even getting a handle on the most basic scientific questions of where and how many is challenging, because we really do not have the kind of reporting and oversight about this incredibly important technology. But the EPA, because of incredibly growing concern about the impacts of fracking on the environment, was directed to study the question of, does hydraulic fracturing impact drinking water? It was primarily from some unfortunate episodes of blowouts and well failures and things like that that led to isolated incidents, but not knowing the national perspective, the challenge in the fracking study in EPA took a systems approach. Now you can say, well, Tom, if you're doing systems, why weren't you also doing air pollution and all the pathways of fracking and the way that influences the quality of our lives and our environment? And by the way, bring in the social scientists too, because what voice do local residents have about this? It's such a complicated system, but EPA being what it is, and the politics of oil and gas being what they are, we were directed to look at drinking water and only water. So we decided, well, let's look at the entire system and cycle of water use with fracturing, from water acquisition. They are hydraulically fractured, millions of gallons of water to fracture a well, to the chemical mixing, the fracking fluids and the lubricants and preservatives and other components that go into the mixture, that is the fracking mixture, to injection at the well, those thousands of feet under, and the horizontal components down to the shale deposits, to one of the most perhaps troublesome and least known aspects of what about the flow back and produced water, and then finally ultimate disposal and wastewater treatment. So we took a systems approach to look at this, and it was really tough. All right, to go over this. So have any of you ever been to a site where there's actually hydraulic fracturing going on? Okay, that's pretty good, because it turns out it's not all that easy. Well, especially if you're from EPA. But although many people have driven past, you see now perhaps the water tanks at a place where they're pumping, and you've seen kind of the historic wells. But you may see the big drill rigs at a fracking pad, but it's actually very hard to understand, and very few people been there. But having been there, it's just amazing technology where literally the wells can go miles down and miles across into the targeted rock formations. On the way down, going through lots of different formations with perhaps vulnerabilities along the way. There's a tremendous need for the integrity of the well construction and the integrity of the process, where this incredibly forceful explosive charge is ignited and then propped open with the hydraulic mixture and the proppants, the fracking sand, to make the recovery of the oil and gas possible. And so you can imagine this is a challenge. So of course, being a kid from Jersey City, I said, show me the bomb. High explosives, I want to hold one of those. So that's me at a site. So actually, shortly after I got to hold this thing, it was used this is from a a fracking site in Arkansas, and I got to dress up like a fracker. Got to be careful saying that fast. Okay. All right. So what are some of the challenges? Well, you put these millions of gallons of water in at very high pressure, and you fracture the ground, and there's a tremendous amount of flow back that comes under high pressure back to the well site, and it mixes with the briny, natural occurring water that may be down there that brings with it as well everything from naturally occurring radioactive materials to this very complex chemical mix, and it returns to the surface. So the question becomes, we have this produced water, also known as flowback, and how do we manage it? And at the sites, you also see an incredibly complex system of recovering the flowback water, sometimes disposing of it through evaporation. That might, in fact, concentrate things, and then there may be some treatment and discharge or storage on site. And originally, one of the original states that was so concerned about fracking was Pennsylvania, where this water was discharged upstream of drinking water intakes. And because of the high bromine content, this is very salty, brackish water that comes back, it changed the chemistry of water treatment and was really increasing the disinfection byproducts from drinking water supplies. We have banned that disposal method, but still disposal methods and reuse of the water very much in question. The research team was amazing, right? Over 300 scientists, from geologists to toxicologists, modelers, and field ecologists, epidemiologists too, reading studies from places like the School of Public Health here, to try and understand everything we could about what is known about the hydraulic fracturing process and the potential risks to drinking water. Here are the findings. And I had to do the press conference. It's interesting when there's a happy press conference. I didn't get to do them. When there are tough calls, and you got to present things that are going to be, well, let's just say a mixed reception. The findings really, for the first time, brought the evidence to the potential threat to our national drinking water resources posed by hydraulic fracturing. From water withdrawals in areas of low water availability. There are actually case studies here in Colorado with low water tables or low flow streams where the taking of millions of gallons of water for the fracking process completely changes the quality of the aquifer. It changes the taste of the water, and people on those wells realize it. Perhaps that's the great awareness of things are different. They're fracking in the area. My water tastes different. But the withdrawals really change availability and can have a tremendous impact on water quality. There are also clearly documented evidence of spills of fracking fluids and flowback produced water. You could see from those lagoons. Imagine managing those lagoons in a extreme weather event or a storm event, but just day-to-day management. Things leak. There were hydrofracking conducted in areas very close to drinking water or even in the drinking water aquifers where there was a mixture of the fracking fluid with the drinking water supplies. There were well integrity failures. I think Colorado has some examples of that where the integrity of the well breaks down. Clearly there's discharge of whether it's fracking fluid or flowback water into the surrounding formations, which may include the drinking water aquifers. Submigration of gases and liquids. So fracking is always kind of a mixture of oil and gas, whether it's methane gas and its potential as an explosive gas. So subsurface migration, I would have to say the biggest challenges that people were most concerned about that were kind of the common problems that we heard about were smells of methane gas, migration of gas into homes, and brackish tasting groundwater, where people were concerned that there was, well, if suddenly my groundwater tastes so salty, then things are, even though you're a mile down, something's wrong, all right? And then clearly inadequately treated wastewater. Where are you going to put all this water that comes back? And now there's more and more a tendency of water reuse. So the report came out. I got to do this press conference, and for once, the EPA report finds fracking can affect drinking water. can be a threat to drinking water supplies. Well, we released this in mid-December, 1 month before the new administration. So already there were journalists saying, yeah, but you release it now, what good is it going to be in this new administration that is so pro-energy, and clearly there were stories about that. Endorsed by environmentalists comes as the Trump administration prepares to rethink regulation of the gas drilling industry. Well, that's the political realities of a scientist right now. So, fracking. Science can work and bring evidence. I think it was really important. From a public policy perspective, I hope this study continues to inform decision makers. Perhaps there's not an audience at the federal level right now. EPA is kind of tied in going forward with the study. It was released, but there hasn't been a continuation. But you all know that others are making decisions. Localities and states are making decisions about fracking. In my home state of Maryland, very shortly after the release of this report, fracking was banned through a state law. And so it is our obligation. Now, I'm not saying that's the solution. And the solution may be much better oversight and best practices for the practice of hydraulic fracturing, understanding the weaknesses in the system and addressing them. But science is needed for that, for energy production. So that's one system. Now I want to go to another place in Colorado, and one of the things, so every administration has their crises, and unfortunately at EPA, and I wonder really how we're responding right now nationally to things like this, but on August 5th, 2015, an investigation at a Superfund site near Silverton, Colorado, triggered a release. So there's contractors down there doing some work at an abandoned gold King mine. And they were concerned about the buildup of groundwater. This is up in the mountains, and particularly during spring thaw, the mine flooded, and there was lots of contaminated water there with acid mine wastes. So there was a 3 million gallon release of mine impact into the mine impacted waters of the Samet Creek and then the Animas River. The river system has a long history, and this is important, of leaking mine waste from hundreds of old and abandoned mines. Right? There's a legacy of the past that's part of the lore of the gold mines of Colorado and the Great West, but it's still out there, and it's still a very important part of the environment of the western U.S. So there are hundreds of abandoned mines throughout the region. The Gold King mine release included many metals, aluminum, or aluminium, the way the Brits say it, iron, manganese, lead, copper, arsenic, cadmium, and mercury. And so this release into that, and I can talk a little bit about the incredible environmental chemistry of this, where there was an amazing bolus. We did, working very carefully with the state of Colorado, immediately get out there and collect samples, establish very conservative recreational screening levels to have some public health risk base for making decisions about the potential impact on health and the use of the river. So just to paint the picture, any of you ever go rafting on the Animas River? Okay. What year? Yeah, okay. It's best in the spring, right? Yeah, it could really move in the spring during spring melt, and that's part of the challenge of this. But as you might imagine, in August, there's relatively low flow, and so this release, so a lot was made about so there's the mine, 100-year-old mine. The release burst out the mine and scrubbed the soil and all the 100 years of slag and waste that was disposed of outside the gold mine down into the creek, the Cement Creek, which had been receiving a constant flow, of acid mine waste, a very acidic creek, no life, no fish. So you have this very acidic environment, and then it gets to the Animas River, that the natural geology has a very high calcium carbonate level. So you can imagine all these metals that are solubilized in very acid water, right? So when they test, like if you ever sell a gold and they want to understand the quality of it, they'll give it a little acid test to see what strength acid it takes to dissolve some of their gold. So metals are very soluble in acid, and so they come down into this creek, the Cement Creek, but then they hit the very basic waters of the animus. And what happens is things come out of solution, and this kind of big gel mix forms. So we have this orange slag. So first of all, anybody want to guess why it was so orange? Okay, what? You ever get orange water coming out of your drinking water pipe? What do you usually think that is? Rust, iron. So it's mostly iron. All right. So in the old days, before I bought antifreeze for my car and just put water in there, and you change the water in your radiator in your car, it would look like that. And that it's primarily iron dominating the scene there. But here you have this mixture, and this is probably a very now infamous photograph in the annals of EPA. But this catastrophic release. And I remember my 2 o'clock in the morning conversation with the sheriff of La Plata. Gina McCarthy called me up and said, Tom, remember you said you weren't afraid of anything? No, and I said, Tom, can you talk to the sheriff? He wants somebody to explain this in English to him. And so I get on. He said, Tom, I'm a cop, and I have to make a decision about that river. Can you tell me what's going on? There's kids who raft there. There's families vacationing there. It's the middle of summer. What do we do? What is it? So I did my best to explain it in English. We actually had a very good conversation because there was a river system that turned orange. Now, August is not a period of high flow, but there's August 7th, all right, downstream in the Animas before it gets to the San Juan. And there's just a few days later. And one thing I learned, John jokes, but I'm from Jersey, and we have a lot of things going into our rivers there. Most of them are not as colorful, so you can't tell. Well, one thing I learned about rivers is you can never sample in the same place twice and get the same answer, because those rivers are flowing, and it's dynamic. It's as dynamic as an air sample, right? So that river is flowing. That system is changing every second, and there's chemistry going on, and there's changes in risk and changes of exposure. And we have to think of it as a system and what's going on, and look upriver and downriver and put it in perspective. Because, and I think it's important when we're in this building and we're thinking about the tribal traditions of this country, I would have to say one of the biggest challenges. So there you have the spill up in the Cement Creek. And there's Silverton coming down the Animas River where it's joined by the San Juan. Now there was a tremendous dilution from once it reached the San Juan, and the samples went way down, the color changed. But you can see we're going through reservations, including the Navajo Reservation. And those rivers to the Navajo are their sustaining life force. Where you and I might be concerned that there's a temporary blip in iron and some other metals in our drinking water, and we're going to have to either shut down a well temporarily or crank up the drinking water treatment. To our Native American populations, this was an assault on their way of life, on their tradition, on their history, and you can't make it go away. And so it was very, very tough presenting the science, presenting the data, and presenting the conclusions. Because it was important to put this in perspective. All right. The Gold King mine release was actually a bolus dose. You know, that's a cool medical term. I like saying that, bolus. So we got this bolus that came out of the mine all at once. That had been trickling out of that mine for 100 years. But we get this major release. We get this change in the river. But when you put it in perspective and use the historical data from the USGS and understand the other mines and the contributions to that river system, the spill was equivalent to 4 to 7 days of ongoing mine drainage from there. And that 9-hour release was comparable to the amount of metals carried in the river in 1 or 2 days of the spring melt-off. All right. Why doesn't it turn orange during the spring melt-off? The river's flowing like crazy, and it's not a bolus dose, but it's there in terms of the total weight and mass of those metal concentrations. Because if you look at the historical flows, well before the Gold King mine, this is the flow of the river. So there's the spring melt-off every year, and there's the release. And so you see there was this blip, but in terms of total mass of metals down the river, it was very unfortunate, very photogenic. But thankfully, working with the state of Colorado and the states in doing the risk assessments, closing some wells, closing the irrigation ditches, working with the tribes to try and avoid any high concentrations. It was managed as a system, and I think we got through it. The bigger challenge, now clearly there's lots of money being spent to remediate that mine, but when hundreds, perhaps thousands of those mines line the river systems in our western states, that is the challenge. That is the challenge. And so anybody know this guy? So I have to admit, as a scientist, I always get a little worried about these kind of things. But the state of California and the wonderful folks in health and environmental protection here, as well as the universities, were good partners in trying to bring data to this and make the decisions about the reopening of the river system. And then we had the governor who went down there. I would have advised him perhaps wade in a little bit more. Don't necessarily get any sediment from the banks right now because it's only a few days later. But there you have the governor on August 11th showing that he felt very strongly that it was time to reopen the river and the river was safe to drink. So what did we say? This was a really tough one for me. Because what is background in a river like that that's been so impacted over the centuries? Right? Well, frankly, I couldn't say the river's clean. There's no heavy metals there. There's no arsenic in the river. There's no impact. Clearly there's impact. You added mass of these metals to the river system. But the data clearly showed that the water quality was comparable to pre-event conditions. That's all I could say. All right. That was a tough one to convince EPA and the powers. Everybody wanted stronger statements than that. But I think we have an obligation to put science in perspective. So the conclusions were, the data indicate the water quality has returned to pre-event conditions. EPA was still going to be there. Tom Burke was the science advisor. Maybe the last true science advisor ever, but we'll work on that. And it was time to move on. And to move on means not to forget about this, but this is a warning shot to how we think about our river systems, how we look upstream. Not a time to repeal, right, the waters of the U.S. and our national strategy for protecting the headwaters of our great rivers. It's a time to think how we can work with the states and locals to protect our water resources because they're in trouble. And then you had to put up with this, right? So this was hard work. This was being at the Emergency Command Center around the clock for a long time. And then, I'm not going to say the fake news or media or anything like that, but ouch, this hurt. So here, why didn't you tell us you polluted the river with arsenic, lead, mercury, cadmium? And there you have the EPA scientists saying, we didn't spill any carbon. Meaning perhaps we were obsessed with carbon emissions and climate change and not watching our river systems. I don't think so, but that's fair game. So now getting to water. You've all heard of Flint, Michigan. What do you think of when you think of Flint, Michigan? I think of the early Corvettes and the amazing pickup trucks that Chevy used to make and an incredible center for manufacturing of very cool cars that could drive very fast. But that's gone now. All right, and Flint, really, you think of lead. You think of lead poisoning in kids. You think of a catastrophic failure of a drinking water system. But really, it's a systems failure in a way that we have to think differently. All right? Surely you've heard of the water quality and the switch from the Detroit water supply to save money into the Flint River, a very industrialized river That was part of the decision by General Motors to change their manufacturing because the river wasn't clean enough anymore as a water source for the cleansing of their auto parts and things like that. But the Flint River was the source of the water, but you probably didn't hear too much about a city that had lost more than half its population. Its water infrastructure was built for 200,000 residents that was down to 90,000 residents, where vast, vast miles of the system led to abandoned homes but had to be chlorinated and kept clean throughout, so the system had clean water. You probably didn't hear about the things that kept me up at night about Flint through that whole time were actually the deaths from Legionella and the potential for catastrophic failure of disinfection of that system during the shift over back to Detroit. As we looked throughout that aging system and tested chlorine. Because long before Flint had lead poisoning, it had boil water advisories because of unhealthy, dangerous levels of bacteria. So the story of Flint is there was because of financial demands and the incredibly depressed financial state of Flint, to save millions of dollars, they went to their old drinking water source, the Flint River, reactivated a very old 1952. I know that's very old because it's as old as me. I went to visit that plant, and there in the spring of 2014 they shifted over, and right away they begin to see upticks in lead throughout the system. Not over the standard for the system of 15 parts per billion, but they begin to see upticks in lead, but that were largely because they were in line with the system-wide standard were ignored, and some would say the books were a little bit cooked about that. And it wasn't until Dr. Mona Atisha published in the American Journal of Public Health her evaluation of the percentage of kids in Flint that had elevated blood leads through that time. And here, just simply put, this is her graph in that journal article of the percentage increase, a doubling basically, and more than that in the high lead level water areas of Flint, where you see the kids' blood levels went up. Now, to put that in perspective though, again, thinking about a system-wide, so at the height of it, 10% of the kids in that area with the highest lead contamination had elevated blood leads. On any given day in sections of Newark, New Jersey, Trenton, New Jersey, and the places where I was health commissioner, we have about 24% of kids at that level. This is a national problem. Flint was in the national spotlight. We have to think about lead in drinking water. We have to think about drinking water in general throughout the country. And many of our schools still struggle with that, particularly the older infrastructure. Now, this is the thing that kept me up at night. I mentioned chlorine to disinfect from the killer bugs, including Legionella. All right, so here you see the water change when it was made, and what do you see there? Well, they have to add a whole lot more chlorine to handle the organic material from the river. But out there in the system, the free chlorine that you need to disinfect until it gets to your tap, until you bathe your kids in it, until it's at the house, the free chlorine was way down. Essentially, in many areas of the city, no chlorine. So it would be like drinking untreated water. Drinking untreated water from old pipes. And sure enough, and this is the real tragedy of Flint, are the elderly people who happened to be vulnerable at that time to the jump up in the microbial contamination of the water. And there you see the true tragedy, the number of cases during that time, and unfortunately led to a dozen or more deaths that we know of Legionnaire's, from Legionnaire's disease in the city of Flint. Lots of temporary fixes. There's still people donating bottled water there. People will not trust that water in Flint in their lifetimes. It's a tragedy. There's free water filters available, and those filters work. They work really well. Lots of good science behind that, and I had to say that because one of the scariest things I had to do. So the president was going to go to Flint. We had been there for 6 months. making all kinds of changes, knocking on every door, showing people how to install these filters, using filters, recommending bottled water, working to change the treatment, switching back to Detroit water, working to remove lead pipes. The president's making a visit. So Gina McCarthy asked me, Tom, can the president drink that water? I said, Gina, we've all been there. You were there. We've been drinking that water for 6 months. He could take a sip. So actually, I had to be the person to describe, very controversial, that the water filtration and the water in Flint was lead-free with the appropriate filtration, and that as an interim step, it was a way to get potable water back to the city. The president did go, and he took a sip. I wish he did a Kavanaugh sip and drank a real... I like water. But at the same time, I couldn't help but feel the science needs to be better than that. So here's a picture from Flint, and there you have, there was a real push to replace the old lead service lines that come in from the water mains into the old homes. So there you have an 80-year-old home with a lead service line, and they're being removed at incredible cost. If you look across the street, you see an 80-year-old home from that neighborhood. And what do you notice about the paint job on that home? It's flaking off, and there's an awful lot of other pathways of exposure there. So indeed, if we're going to take care of the environment, if we're going to take care of public health, we have to really think about how are we doing this. One of the continuing challenges of Flint is if you only look at the drinking water, you're not really protecting the kids. You have to think of total lead exposure. And so this is the modeling. Because I never got to be there for this decision, but the big decision is, when do you take the filters off, and when is Flint water safe to drink for everybody, and safe to bathe your kids, and safe to cook with? And what level of lead is an appropriate national standard? Because 15 parts per billion can lead to, particularly in high-risk kids, a lot of lead. So if you think of lead exposure and you model the different contributions, particularly for 1 to 2-year-olds with that rapidly developing brain. Now, the blue is the contribution from water ingestion. But if you're not going to look at soil and dust, particularly in the infants and the crawlers around the floors, if you're not going to look at the pathway of lead in our food, you're going to completely underestimate your focus, because for the kids most at risk, whether it's Flint or whether it's Denver, are not going to be at risk from the drinking water, but rather from other aspects, food and lead dust in the environment. So we have to think systems. We have to think different. Environmental problems are changing. Energy, food production, transportation, land use, and sustainable communities. The National Academy has looked at this and really called these things wicked problems. They're complex. They're difficult to define. They're socially complex, and they extend way beyond one discipline. They recommended environmental problems are interconnected. They recommended that EPA enhance the integrations of systems thinking into its work. This is way beyond EPA. This is our universities. This is our scientific community. We have to enhance our capacity to do systems thinking on all aspects of how we think about public health and the environment. What are we really trying to protect? How can we solve today's environmental problems? And how do we get to the right science to derive the solutions? And so I want to finish with just a couple of initiatives now. And one is, I got the pleasure, to, as I mentioned, to work with Dr. Samet on this at the National Academy. The Environmental Health Matters initiative is being launched now. And this is an initiative to think across all of the academies, to transform the way the nation addresses complex problems, to examine the environmental effects on human health. And we'll bring together expertise across the sciences, including the social sciences, to explore the latest science to improve the practice of environmental health. Progress in our field will require coordination across multiple communities and multiple sectors, not the traditional approach to environmental health. We need strong upfront problem solution. You have to map out the system before you start your research and think of the contributors to what you're trying to do here. You have to think of new ways and new tools from human health and social sciences to draw on new technologies, to consider novel techniques, and the new approaches of ecological risk assessment, health impact assessment, and life cycle assessment. We're really hopeful that we'll, taking the lessons from Flint, thinking about the National Academy during this time of turmoil and stasis in environmental protection, we have an opportunity to transform how we comprehend environmental health and to understand that complex interplay between the environment and human health. And so mapping out the system, we've put together a map of the system. Most people really don't think about the external drivers and the political aspects of an environmental challenge. I won't go through this whole fancy work in progress, but mapping out the system is a very important first step. And I just want to close with some stuff, and it's a little advertisement for Hopkins, because this isn't just a realization of the EPA Science Advisor. This is our entire field. And at Hopkins, with the help of the Bloomberg Philanthropies, we're helping to define public health in a different way, using an approach that defines the problem, measures the magnitude, but includes the key determinants of the risk, not just epidemiologic, but social and political factors, to develop and support new ways of recommending policies, using tools such as health impact assessment to change the way we include people in the policy process and track changes in community health. This is a really complicated diagram using the example of a community aspect and how you would go ahead, say the city of Denver, in redeveloping to a healthier environment, bringing in the regional planners, thinking about landscape and architect, the small businesses and housing, transportation engineers, elected officials, and how we might be prepared to integrate this information, develop the right metrics for a healthy community, and get to that desired state of walkable and bikeable cities, for instance, open space, social gathering space, a place that sustains a healthy environment. Thinking not just molecularly, but thinking of the interconnection of our environment down from the very subcellular level to the global ecosystem level we're in. So in conclusion, so these are bad times, all right? But it's a time to rethink. And I think during the past decades, whether it's the Clean Air Act, Clean Water Act, we've divided into silos. We divided into silos in most of science. But today's wicked problems require a new way. Regulation is not the only answer. So while I defend regulations on lead and things like that, we have to think a different way because our regulatory system, as we're seeing, is bogged down and vulnerable to the delay game or to extinction. The one molecule at a time, one substance, one media at a time, just thinking water, is no longer going to be adequate to promote public health. We have to look upstream and map out the systems approach. Most of our environmental problems have social, political, behavioral, and economic roots. We have to understand those. Reducing environmental disease requires more than regulating specific molecules, but building healthy communities, designing for the future. It's about public health. I'll stop there. Thanks.
Tom, thanks so much. And you left a minute for questions.
Well, I don't want to get any tough questions from people who may disagree.
So let me make a suggestion. Those who need to dash at one, do so. And otherwise, let's field a few questions. And I'm sure after we're done with formal things, Tom would be happy to talk to you. So, questions or comments?
Yes. Hi.
Katie.
Problems and potential solutions. I wonder if you could just touch a little bit on some of the social systems. I think, the Flint example, we think a lot about, systemic racism in contributing to that problem, and maybe you touch a little bit on the role of some of the social systems and sort of environmental justice in these discussions.
My time at EPA, I really tried to bring more social scientists to the table to help us before we went out into the field. And probably the two most poignant moments of my life at EPA. One came in Flint when I met with the pastors and community members. When it was really the first visit, things were really, really hot and people were angry. And I met with community leaders. I'm the only white guy in the room. All right, so and Gina McCarthy is there. She's the only white woman in the room. And she introduces me, Tom, our science advisor from Johns Hopkins, and said the things you say when you introduce a scientist. And the leader of the pastors stood up, looked me right in the eye and said, Dr. Burke, all due respect, we don't need no science projects. We need clean water. Gina, you brought the wrong guy, right? Or we brought the wrong team. And it's not just about the chemistry of water disinfection and the pH of the water source and all those cool things that I could have gone to great length about. We need to map out the real questions. So when I say upfront problem formulation, make sure the social scientists are sitting there. The second most difficult was explaining to the president of the Navajo Nation that the water had returned to pre-event conditions. That water will never return to pre-event conditions. They will never have that summer back, that livestock that didn't get watered, that irrigation that didn't happen, the crops that were lost, and the spirit that they lost from their mother, the river, being contaminated in their eyes forever. We really need to think about, in our problem formulation, identifying, just as we identify the chemistry problems and the environmental problems and the pathway problems, the social issues that we're going to confront. And you get the same thing from the business community. One of my favorite Senate hearing questions is, Dr. Burke, what's more important? A clean environment or jobs? So, well, Senator, they're not mutually exclusive. And anyhow, you can imagine my answer. But so the social scientists have to understand all of this. And so that's what I mean by systems thinking. We're not great at it. Social science, we have to stop thinking of social sciences as soft science. That's the hard stuff. The easy stuff is doing the measurements and knowing how much chlorine residual there is in the water. The tough stuff is getting the message across and restoring confidence in science again in this country. People have lost confidence. So, long answer. I'm sorry, John. That's more than 1 minute. Yes. Yes.
So you mentioned about a system approach. Earlier this year, the CDC created public health emergency law competence and the public health law competence model. They created this early this year. So in your content expertise, and what's the role of law
in understanding the system?
Here, how we enhance evidence-based public health law here?
That's a great question. Law should be at the table. The laws have both helped us. We've made tremendous gains in this country in environmental quality, but we have also been completely subject to the limitations of our current laws, which have divided the environment into legal avenues. So, for instance, why? I helped author the Superfund legislation. And those of you who are from New Jersey know that New Jersey has more contaminated chemical waste sites than any place in the country. And we wrote that law to tax the chemical industries to have cleanup monies for abandoned hazardous waste sites, chemical waste sites. What's it doing at the Gold King mine? Because EPA only has 5 hammers. Air, water, waste. We don't have a soil law. We haven't thought of the environment as a system. So one very important place to start is looking at our statutes. And believe me, I think a lot of people in industry would jump up and down to hear Tom Burke say, these laws are bad. They're not. I was going to say another word. But these laws are fragmented. And we've got to start thinking about integrating our legal approaches as well. Because the law has created these, in Washington, they're called lanes. And one of the things, like, I would bug the crap out of people when I said, we regulate lead in air completely different than we regulate it in water. We have different safe doses. We have different science for all of these different regulations subject to laws. And I would hear, stay in your lane, Tom. The lanes are defined by the laws, and unfortunately they constrain us in doing these kind of things. So law is one of the first places to look. Great question. Yes?
Great talk, thank you. But following up the previous two questions about systems approaches, and I hear CDC increasingly talking about systems approaches, but isn't that what public health has always been about?
Yes, and that's...
What's new and different about a systems approach other than new...
Thanks for saying that, because I didn't put the quote in here because I knew John would be mad at me. I had too many slides. But I have this quote from this great book about Humboldt. Alexander von Humboldt, who's credited with discovering nature, discovering ecology and the systems. So most ecologists really get it, that there's a system out there. But public health people, unfortunately, have been subject to those laws and policies. But those of us in public health who understand how we look at the contributors to health and look at the global burden of disease, we understand. So one of the things that's really exciting about the Environmental Health Matters initiative is that it gets us back to our systems roots, our public health roots, because I think in public health, we define the problem very much in terms of the many, many things that contribute to well-being. And we know that employment is really important. We know that income is really important. We know that insurance is important and laws. And then on top of that, air quality really affects health. But if you want to lift up a community, you have to think from a public health lens. So excellent question, and you're right. And so this isn't really great innovation. This is kind of back to the future and respecting our public health roots and our ecological roots. And perhaps if you really read his writings, the initial executive order that founded EPA by Richard Nixon, I am not a crook Nixon, all right, actually talked about a system of programs that would come together to think about the total environment. We've just gotten really far removed from that.
So I think, let me make a suggestion. I want to thank Tom, and anyone who wants to continue to have a conversation with Tom, come on down. And thanks so much, Tom.
Thank you, John.